Good morning, Las Vegas. This is Tina Drago with Healthy Las Vegas, coming to you from Studio A at Beasley Broadcast. Today I'm going to kind of change it up a little bit. We've been talking a lot about what's going on in Las Vegas. We've been talking about all the different resources that have been available, and we've been giving you different ideas on different specialists and doctors in the community, as well as other things that can make you happy and healthy, like giving back and philanthropy, making sure you communicate effectively in the workplace, making sure that you understand your rights as an employer and an employee. But today, we're going to talk about federally qualified healthcare centers. Now, First Person Complete Care is not yet a federally qualified healthcare center or ordained a federally qualified healthcare center. But for all practical purposes, we have been working as one for almost 3 years now. This March, it'll be 3 years. And we opened our doors with that value system and that objective in mind. So let me explain to you what a federally qualified healthcare system is. A federally qualified healthcare system is a community health center. They're nonprofit. They're designed to They're designed to take care of your community. Now, your community could be large, like Las Vegas, or it could be smaller, like a pocket of downtown, or an area on the Near East Side, or maybe near North Las Vegas. And those communities have dense populations of people that normally do not have a large medical base there. So there's not a lot of doctors. You can't walk across this clinic or to the streets to a minute clinic. And they usually don't have all the resources in the neighborhoods that you would need to keep a healthy lifestyle. So let's go break it down. Most of these neighborhoods are poor. Most of these neighborhoods don't have resources that a lot of us take for granted. Some of these areas are rural and have very limited resources because of they're geographically located way out in no man's land. And this is where usually you'll find federally qualified healthcare centers pop up. Now, you can't just be a nonprofit community health center giving back and say that you're an FQHC. It's a very vigorous process to go through. So a couple of the things you should know about federally qualified healthcare centers is that they give the highest level recommended by the federal government and their guidelines to their patient population. So just because they're taking care of poor people or people without resources or people who are isolated does not mean that they are not taking care of them 110%. I have said this before, and I get on my soapbox, but truth be told, federally qualified healthcare centers provide the highest level of comprehensive care that a person can receive at very economic prices because they're being subsidized by the government, taxpayer dollars. But with that, it's a double-edged sword when the government gets involved. So with that, we have criterias to meet. Some of those criterias are that we address our specific population with all the tools and resources that they would need. So let's talk about downtown Las Vegas, because that's where I am and that's the area I know really well. Downtown Las Vegas is a complete cacophony of people. We have people who don't speak English as a first language from multiple community backgrounds, whether it's Hispanic or Asian, or Russian even. We have people who are transgender, bisexual, gay. They have families. They are isolated. Sometimes they are trafficking and selling themselves, but we deal with that mix and array of people as well. We have youth who are in the juvenile justice system and getting out. We also are very close to the homeless centers, and we're very close to Catholic charities and some lower income housing. But on the exact flip side, we are also very close to the high rises and the people who live in $1 million lofts, and they like the urban experience and they like to be right in the middle of the action. And we are close to people who have been in Las Vegas for multiple generations and have always lived in the downtown or near east areas. Think of like Rancho Circle, where they have means and they have resources, but they don't want to leave their community. And part of them living downtown in the urban area is that they use the resources within their community. So we have those people as well. So literally on any given day, somebody at my community health center downtown can pull up in a Bentley, or they can come on a bus. And so when we address our patients, we address them not by their income level, we address them by their needs and our community. So a couple of the things that we really focus on at First Person is our clinic doesn't look like a clinic. Our clinic looks more like a Art Deco medical office because we're in the art district. So let's embrace our community and our image of what's down there. We're very pro Las Vegas because we're in the city. In fact, we're the only community health center in the city of Las Vegas, downtown. Everybody else is in the county areas, and there are needs all over the county. So we take special pride in being in the city. We also have couches, and our exam rooms are for waiting rooms. We have couches, and our exam rooms are really big. They're bigger than the normal exam room because when our patients come, they just don't come by themselves. It's usually mom, dad, brothers, sisters, grandma, grandpa, aunts and uncles, and a cousin or two all come in together because when someone needs help and their health is lost, they come as his family. Because that's how our community is situated. The people in our community like family. That's their core. So a lot of times our providers are not only taking care of the patient, but they're counseling their family members, they're counseling their partners on what they can do to support the family and the person who's ill at that time. We are also very proactive when it comes to contraception, family planning, because we are close to the transgender, bi, gay, lesbian population, the LGBT community. We're very pro condoms and safe sex. We discuss that with almost every one of our visits. Because we want people to know that there's a resource. There's a resource in our clinic. So because the people in the community of downtown Las Vegas may or may not have limited resources, what we've found is that if you don't have resources, we will put them together for you and we will help you find them. And if you do have means, you may not know where those resources are. So we will also help you. So part of First Person Complete Care's clinic is that we actually have a pretty comprehensive care coordination team. And what I mean by that is, you know, when you normally go and your doctor checks out and he gives you a prescription and then gives you a follow-on date, and then you're expected to come back or go get your prescription or do whatever you need. A lot of the people that we work with as patients either don't have a pharmacy, don't know where they can get their drugs filled, don't know about patient assistance programs. We'll help with all that. Because people insurance hop quite a bit in this area, may or may not know if their providers or the specialists we send them to accept their insurance. So we'll also make sure that we help them with referrals. We'll help them make sure that they have transportation to these referrals. We'll even follow up with phone calls to remind them that they have a referral, appointment coming up, maybe with a specialist, or that they have to get a lab taken care of. Maybe they have to get an x-ray or an image. We will follow up with them, make sure that they know the date, time, coordination, that they have transportation, and that they can get there, because we don't want them falling through the cracks. And a lot of people are non-compliant, not because they choose to be non-compliant. They're non-compliant because maybe they don't have the resources to get it all done. And we're sensitive to that situation. And because so, we will also help them with any assistance programs that are available out there. Part of my team's real area of shining is that they research a lot, they know what's out there, and they have opportunities to connect the patient with the resources they need so that they can get the best care possible. Being an FQHC is not just a title. You actually have to walk the walk, and you get audited on these walks, and they make sure that you're doing everything that you need to do to provide the highest quality of care for your patients. So things like when you're discharged from the hospital, being able to see your doctor within 72 hours is part of being an FQHC. Having immediate appointments available is part of being an FQHC. Having translation lines and multilingual staff is part of being an FQHC. Care coordination and networks and collaboration with other resources in the community is a must for being an FQHC. Not only that, if people are uninsured or underinsured, and you know who you are, you're the people with the $5,000 deductibles paying $300 a month for health care that you can't afford to take. FQHCs will put you on an income-based sliding fee scale. And that means that if you can only afford high deductible insurance policies, we'll make sure that you can come in and see a doctor without having to pay that high deductible. We'll actually discount it in the clinic for you. And we do that because we don't want to have any barriers or access to health care. We want those barriers eliminated. And we know that many people who have insurance have it for catastrophic needs more so than they do for primary care needs. The primary care needs of making sure your labs are done and that your medication's proper, that you've balanced your meds, that you are actually taking the proper dosage at the proper time. Those little things will actually keep you from your health declining. And we don't want your health to decline. We want you to get better. We want you to be in control of your lifestyle and your health and everything that you do. So by having you come in and see a provider at a reduced rate is part of us making sure that you have no barriers when it comes to access to health care. Now that you know what an FQHC is, we have several of them here in town. We have First Med, we have Hope Christian, we have Searchlight, and we have the big one, which is Nevada Health Centers, and soon First Person Complete Care. But every one of these is a little different. So you hear me talking and you hear what I want to project for my particular health center. But each one of them has their own specialty and they have their own area. They focus and they have their own culture. So just because we're all FQHCs doesn't mean we're cookie cutter in any stretch of the imagination. In fact, Nevada Health Center's big push is that they are in the rural areas of Nevada, and they do a phenomenal job out in those rural areas providing comprehensive care to people who are in isolated areas. That's something that First Person wouldn't be able to do because our strength lies in collaborating, and we collaborate with many different organizations here in Las Vegas to provide you with a comprehensive care here. So each one has their own style and their own unique way of approaching the patient. What I want to really stress is the need for providers in these healthcare centers. In these community health centers, providers that come in, providers that succeed, doctors, nurse practitioners, and PAs are, they're really the soul of what's going on in these health centers. And they're the ones who the patient gets to establish a relationship with. They're the ones who fight as an advocate for the patient. They're the ones who actually take the mission that we have to help the vulnerable population in the community around us, and they make it come to life. So you take your provider, and at First Person Complete Care, we use doctors and nurse practitioners. We don't use PAs because PAs have to collaborate with an MD, and our medical director is a DO, doctor of osteopath. So just for the details. But we use doctors and nurse practitioners, and our doctors and nurse practitioners are really the lifeline of what makes our clinic as special as it is. We have a culture of respect. We respect everybody and we take care of everybody in that manner. We are not judgmental. I would be really surprised and hard-pressed to find a provider in our clinics that would judge you. We deal with your situation. We're very empathetic. Your situation could be that you're a millionaire and you have no friends and nobody loves you. Because you are a millionaire, and because of that, you don't know where to go because nobody will tell you which doctors are the best in town. We'll even empathize with you if that's the way. But we empathize with everybody, and we know that everybody has their walk in life. Today's show is about getting out the message to the providers who truly, truly, truly could be the lifeline and the heartbeat to a federally qualified healthcare center. The state of Nevada is so far behind in developing these federally qualified healthcare centers that honestly, in the next probably 2 to 5 years, we will just explode in the state of Nevada and have federally qualified healthcare centers throughout the state, which is what we should have had 20 years ago. But we're a little slow and we do it our own way, and no excuses. But honestly, in the next, for our clinic, in the next 1 year, we should open up 3 more clinics minimum, 7 satellite clinics. And we're going to be in need of providers, nurse practitioners, and doctors. We want you. We want you who want to give back. Now, here's some of the perks about being with a federally qualified healthcare center. And this goes for all of us. Tuition reimbursement for you young providers getting out of medical school. We are part of the National Service Corps site, so your tuition can be reduced up to, I believe, $30,000 a year, and it would all depend on your credit and your collaboration with the government. So it's like you're going to get a bank loan to pay down your student loans, and that bank loan is tied to your commitment with the community health center. So when you're out there graduating, think about that. Think about 3 to 5 years working for a nonprofit community health center, getting a competitive wage, but getting also bonused on having your tuition reduced. There's community health centers, urban and rural. I know the old days you used to think it was all rural and you had to go to like Alaska to have your student loans forgiven, but that isn't the case now. We're in urban areas as well, and the same applies for the urban areas. You will get a wonderful mix of patients. You're not going to get just the hypertensive, diabetes, blood pressure. You're going to get behavioral. You're going to get patients that are new families. You're going to get geriatric patients. We have a fabulous patient. She's 99 years old. She'll be 100 in February, and doesn't take any medicine. She's a walking mystery. And then we have our young patients who are 30 years old who are on just cocktails of medicines because their bodies just aren't doing what they're supposed to do. But I can honestly say, working in a community health center, there will never be a dull moment. And there's always a need for good providers out there. If you are interested in sending me your resume, collaborating at our clinic, know that you'll get a competitive rate and you'll have tuition reimbursement opportunities. And you can always send your resume to info, I-N-F-O, at firstpersonCC.org. That's info at firstpersonCC.org. Or you can call the clinic directly at 702-380-8118, option 3. And someone will be more than happy to talk to you about coming on board. We have our clinic downtown. We are looking to open up our Veterans Transition Clinic with a collaboration with the Nevada Health Centers in North Las Vegas. And we will be in Nevada Hand Senior Properties in 2016. So right there, that tells you we have options for growth and we have options for providers. And we're looking for a few good people out there. Men, women, Hispanic, Asian, we'll take any of y'all. And just know that our mantra is to respect and that we're here to help in the community and that you will have a job that will not take you overnight, will not take you away from your family, will give you a wonderful quality of life, and you will get up every morning knowing that you are making a difference in somebody else's life, maybe multiple times throughout the day. But you will be on the front line of making sure that people who didn't think they had resources and didn't think they have options now have the best. I would put us up against any concierge medicine, any college medicine. We work in a collaborative, team-based atmosphere. We're high-tech. We're bidirectionally integrated. Everything is paperless. We utilize our tools, and it's an opportunity to really make a difference and be cutting edge at the same time. Some of the things we do with collaboration, where we collaborate with Veterans Transition and we collaborate with the Southern Nevada Health District and the different universities, and we're a teaching clinic for Roseman and UNLV and College of Southern Nevada and Toro. And when we get out there and you're integrating with all these different organizations, you have opportunities. And these opportunities will allow you to grow, and they'll allow you to be the best you can be. And that's another thing I want to point out. Continuing education is part and parcel of being a provider with a community health center. There isn't one FQHC or community health center out there who doesn't expect you to continually educate, find the latest technology, bring it in, incorporate it into your day, and grow. You'll never be stagnant. You'll never be bored. Community health centers here in Las Vegas are growing. The opportunities are growing, and we're looking for some good people out there. Once again, 702-380-8118, option 3, or info@firstpersoncc.org. Please send us your resumes. Send us your timelines, your information. If you've newly graduated and you want to just jump in feet first and know that you'll have a staff around you that will support and nurture you and help you be the best provider you can be, this is the place for you. If you want to come to Las Vegas and you live in the north and you don't and you don't know how to get down here, we will definitely be the place for you. Las Vegas is growing. Nevada is growing. Federally qualified healthcare centers are going to be the primary care of the future. The one-off providers are not going to be able to provide you with the resources and the care level that a community health center can provide you. And if you are a federally qualified community health center, then you know that you are doing and serving and gathering the best there is out there as far as information, resources, people, personnel, and you're making sure that our 10% of the population that accounts for 80% of our medical expenses is being taken care of, so that we can reduce health care where it lies and where it's most difficult. And that's for the people who didn't receive health care, bouncing in and out of hospitals. We can help you with that. We can help you make a difference in Las Vegas. We can help you make a difference in your life, and we can help you have total job satisfaction. Once again, First Person Complete Care, 702-380-8118. Option 3, or info@firstpersoncc.org. This is Tina Drago saying thank you very much for listening, and keep those letters coming in. Take care.